Many people experience anxiety about going to the dentist. It's a common fear. However, for some, this fear is so intense that it dictates their life choices. This is dentophobia, an extreme and often irrational fear of dentists and dental procedures. Statistics show that dentophobia affects millions worldwide, preventing them from seeking much-needed dental care. This avoidance can have serious consequences for both oral and overall health. This essay will explore dentophobia in detail. We will examine its causes, symptoms, and the profound impact it can have on a person's well-being. We will also delve into effective treatment options, focusing on the power of exposure therapy. Real-life examples will illustrate how this approach helps individuals overcome their fear and achieve lasting dental health. Understanding dentophobia is the first step towards conquering it. By shedding light on this common phobia, we aim to empower individuals to seek help and regain control of their oral health. Remember, you don't have to face this fear alone. With the right support and strategies, you can overcome dentophobia and achieve a healthier, happier smile. Let's begin our journey towards understanding and overcoming the fear of the dentist's chair. Dentophobia is more than just being nervous about a dental appointment. It's a severe anxiety disorder that triggers intense fear and avoidance behaviors. People with dentophobia often experience overwhelming feelings of panic, dread, or terror at the thought of visiting the dentist. These feelings can be so powerful that they lead individuals to avoid dental care altogether, even when they are in pain or discomfort. This avoidance can have serious consequences for oral health, leading to untreated cavities, gum disease, and other dental problems. It's important to understand that dentophobia is not a sign of weakness or a character flaw. It is a real condition with identifiable causes and effective treatments. Recognizing dentophobia for what it is, a treatable anxiety disorder, is the first step towards overcoming it and regaining control of your oral health. In the following sections, we'll explore the common symptoms of dentophobia, the underlying causes that contribute to its development, and the impact it can have on various aspects of a person's life. Dentophobia can stem from various sources. One common cause is a negative past experience at the dentist. A traumatic childhood dental visit, for example, can leave a lasting impression and create a learned fear response. Another contributing factor is learned behavior. Children who witness a parent or sibling expressing extreme fear of the dentist may develop a similar fear themselves. This is particularly true if the child observes the adult being comforted or rewarded for their fear, as it can inadvertently reinforce the idea that dental visits are something to be feared. Furthermore, societal factors can play a role. Negative portrayals of dentists and dental procedures in movies, TV shows, or books can contribute to a general sense of anxiety and fear surrounding dentistry. Understanding the root causes of dentophobia is crucial for developing effective treatment plans. By identifying the underlying factors that contribute to an individual's fear, therapists can tailor interventions to address those specific issues and help patients overcome their anxiety. Dentophobia can manifest in various ways. Recognizing the signs is crucial for seeking timely help and preventing the fear from escalating. If you experience any of the following symptoms, it might indicate dentophobia: intense anxiety or fear at the thought of visiting the dentist. This fear can be so severe that it interferes with your daily life, causing you to lose sleep, miss work or school, or avoid social situations. Physical symptoms. Dentophobia can trigger a range of physical symptoms such as sweating, racing heart, shortness of breath, nausea, dizziness, or even fainting. These symptoms often appear before or during a dental appointment. Avoidance behaviors. You might go to great lengths to avoid dental visits, even if it means living with pain or discomfort. This avoidance can include canceling appointments at the last minute, neglecting regular checkups, or refusing necessary dental treatments. Negative thoughts and beliefs. Dentophobia often involves negative thoughts and beliefs about dentists, dental procedures, and the potential for pain or discomfort. These thoughts can become deeply ingrained and difficult to challenge without professional help. If you resonate with these signs, remember you are not alone. Dentophobia is a treatable condition, and professional help is available. Dentophobia's impact extends far beyond the dentist's chair. It can significantly affect various aspects of a person's life, including their physical health, emotional well-being, and social interactions. The most immediate consequence is the deterioration of oral health. Avoiding dental checkups allows dental problems to escalate, leading to more complex and potentially painful treatments down the line. Untreated dental issues can also impact overall health, increasing the risk of heart disease, stroke, and other systemic conditions. Emotionally, dentophobia can lead to feelings of shame, embarrassment, and low self-esteem. The fear of judgment from others about their oral health can make individuals self-conscious about their smile, affecting their social interactions and confidence. This can lead to social isolation and withdrawal, further impacting their quality of life. The good news is that effective treatment options can help individuals break free from the grip of dentophobia. By addressing the fear and its underlying causes, individuals can regain control of their oral health and improve their overall well-being. Overcoming dentophobia often requires a multifaceted approach involving professional help and self-management techniques. Various effective treatment options are available, and the best approach often depends on the individual's specific needs and the severity of their fear. One common and effective method is cognitive behavioral therapy, or CBT. CBT helps individuals identify and change the negative thoughts and behaviors that contribute to their fear. Through gradual exposure to feared situations and the development of coping mechanisms, CBT empowers individuals to manage their anxiety and regain control. Another valuable tool is relaxation techniques. Deep breathing exercises, meditation, and mindfulness practices can help reduce anxiety and promote a sense of calm. These techniques are particularly helpful in managing physical symptoms of fear, such as rapid heartbeat and shortness of breath. In some cases, medication might be recommended in conjunction with therapy to manage severe anxiety. Anti-anxiety medications can help reduce feelings of panic and make it easier for individuals to engage in therapy and face their fears. Exposure therapy stands out as a highly effective treatment for dentophobia. This approach focuses on gradually confronting the fear in a safe and controlled environment. The idea is to desensitize the individual to the source of their anxiety by gradually increasing their exposure to dental-related stimuli. The process usually begins with simple steps, such as looking at pictures of dental instruments or listening to the sounds of a dental office. As the individual becomes more comfortable, the exposure progresses to more anxiety-provoking situations, such as sitting in the dentist's chair or having a cleaning. Exposure therapy works by breaking the cycle of fear and avoidance. By repeatedly facing their fear without experiencing negative consequences, individuals learn that their anxiety is unwarranted and the feared situation is safe. This process helps to extinguish the fear response and replace it with a sense of mastery and control. The effectiveness of exposure therapy lies in its gradual and structured approach. It allows individuals to confront their fears at their own pace, building confidence and coping skills along the way. The support and guidance of a qualified therapist are crucial throughout the process, ensuring a safe and successful experience. Let's illustrate the power of exposure therapy with a real-life example. Sarah, a 32-year-old woman, had been struggling with severe dentophobia for over a decade. A traumatic childhood experience had left her terrified of dental visits, leading her to neglect her oral health for years. Sarah's fear controlled her life. She canceled countless appointments, lived with constant tooth pain, and avoided social situations out of embarrassment for her smile. Desperate for a solution, she decided to try exposure therapy. Under the guidance of a therapist, Sarah began her journey by looking at pictures of dental offices and listening to recordings of dental drills. As she gradually became desensitized to these stimuli, she progressed to visiting the dentist's office for brief periods, sitting in the waiting room, and eventually sitting in the dentist's chair. The process was challenging, but with each successful exposure, Sarah's confidence grew. She learned to manage her anxiety using relaxation techniques and began to challenge her negative thoughts about dental visits. After several months of therapy, Sarah successfully underwent a dental cleaning, a milestone that once seemed impossible. Sarah's story is a testament to the transformative power of exposure therapy. By gradually confronting her fear, she regained control of her oral health, improved her overall well-being, and achieved a brighter, healthier smile. Finding the right dentist is crucial for anyone, but it's especially important for individuals with dentophobia. A compassionate and understanding dentist can make a significant difference in your experience and help you feel safe and comfortable throughout your treatment. When choosing a dentist, look for one who specializes in treating anxious patients. These dentists are trained to create a calming and supportive environment and are skilled in communication techniques that help alleviate fear and anxiety. Don't hesitate to ask potential dentists about their experience in treating patients with dentophobia. Inquire about the strategies they use to create a positive experience for anxious patients and whether they offer sedation options, such as nitrous oxide or oral sedation, to help manage anxiety during procedures. During your first appointment, communicate openly with the dentist about your fears and concerns. A good dentist will listen patiently, answer your questions thoroughly, and involve you in the decision-making process regarding your treatment plan. Remember, you are in control, and you have the right to understand and consent to all aspects of your care. It's essential to remember that you are not alone in your journey to overcome dentophobia. Various support systems and resources are available to help you navigate this challenge and achieve lasting dental health. Support groups provide a safe and understanding space to connect with others who share similar experiences. Sharing your story, listening to others, and exchanging coping strategies can be incredibly empowering and provide a sense of community. Online forums and communities dedicated to dentophobia offer another avenue for support and information. These platforms allow individuals to connect with others worldwide, share their experiences, and access valuable resources, such as articles, tips, and advice from mental health professionals. If you're struggling to find local support groups or prefer professional guidance, consider seeking help from a therapist specializing in anxiety disorders. A therapist can provide personalized support, teach you effective coping mechanisms, and guide you through the process of overcoming your fear. Dentophobia is a common and treatable condition that affects millions worldwide. Understanding the causes, symptoms, and impact of this phobia is crucial for seeking timely help and preventing it from controlling your life. Remember, you don't have to face this fear alone. With the right support, treatment, and self-care strategies, you can overcome dentophobia and achieve lasting dental health. Effective treatment options, such as exposure therapy, cognitive behavioral therapy, and relaxation techniques, can empower you to manage your anxiety and regain control of your oral health. Taking the first step towards seeking help is often the most challenging part. Remember that acknowledging your fear and seeking support is a sign of strength, not weakness. Embrace the journey towards a healthier, brighter smile, and know that you have the power to overcome this challenge and live a fuller, healthier life.